It is so challenging these days not to experience human touch and hug your elderly loved ones, but Nurse Barb is here to tell us how we can do it safely. Hi, Barb, how are you?
Hi, it's great to see you. And I want to show you the best way to keep everyone safe. And it's all about ventilation. Here's a fan, right?
Yeah.
So with this, right, you see this? This is how we circulate the air. And that's how we reduce the number of aerosols and droplets that we're coming into contact with. So if you're going to be seeing someone who's elderly, think about the place they are. If they're in another state, you need to find out if you have to quarantine before you see them. Some states are requiring 2 weeks. Some facilities will not even let you in. So call ahead of time. Many facilities will let you see an elderly loved one if you see them outside. And what if the temperature is bad and there's no air circulation? You can bring or buy a fan. You can also do this for outside get-togethers with neighbors. Just keep that air circulating. It reduces the number of droplets that could be potentially infecting someone.
Okay, make sure you have a fan. That helps.
There's a couple of other things. If you're visiting someone who's elderly, talk to their healthcare provider and find out if this is a good idea from them first. And then you have to kind of juggle the risk benefit. Many people just don't feel like it's worth living without that human touch. And that's very valid and very important. So you can do what we do at the hospital. You might get a heavy duty coverall that's rated superior for splash protection. We used to have to use these before we got adequate PPE or personal protective equipment. When you get to their house, have a separate set of clean clothes already washed that you haven't worn in a plastic bag. So if you get to their house or you get to a hotel, you can take a shower, wash and dry your hair, and put on clean clothes. Of course, try to get the best mask you can, like an N95. And if you can't, then wear at least 4 layers and make sure your loved one is wearing 4 layers. Also, goggles and face shields for both people is a really, really good idea. And make sure you have plenty of gloves.
Also, just the same sort of things, right? Make sure you wash your hands, sanitize everything before you even go near them.
Yes, sanitize, sanitize, sanitize. And then even when you're hugging, if you're deciding to hug someone, you turn your head to the side, have them turn their head to the side. You might also decide that it's better to come up behind them and give them a nice back rub if they would like that. So there's lots of ways to touch without having face-to-face contact. I also want to remind everyone, if everyone wears a mask, we reduce the transmission rate by 97% when both people are wearing a mask.
Okay, so if you want to experience that human touch and you want to hug your elderly loved ones, just protect yourself and protect them. Gear up.
Gear up. And remember, there's no such thing as 100% safety, but do the best you can.
All right, Nurse Barb, virtual hugs, air hugs.
Thank you. Okay. Okay.